Welcome to Real Tech, Real Talk, a podcast from cxposy.tech. Today, we're diving into one of the most transformative developments in healthcare, predictive analytics. Joining us to share his unique insights on how predictive analytics is revolutionizing patient care and transforming the healthcare landscape is a physician who transitioned into the tech space, Dr. Terence Tan. Let's get into it. Hi, Dr. Terence. Welcome to Real Tech, Real Talk.
Hi, Kumaran. Great to be on.
All right, let's begin with a little bit about your very interesting journey from a physician into the tech space.
Yeah, I get that question a lot. So I'm a primary care physician and immunologist by training. I worked in the NHS for a couple of years. I moved to Singapore, done public practice, private practice, bit in NGO, a little bit at ministry level. Had my own businesses that I exited from, and then got involved in clinical AI 6-7 years ago, first with Babylon Health for a few years, and then I moved on to UB, which is a sort of late stage startup now, where I was their medical director, helping out on the medical development of the technology, as well as towards the front of the house with the business development, partnerships. And then I joined a big tech company about 2 years ago.
Thanks for the intro, Dr. Terence. From a healthcare perspective, I think we are at a fascinating inflection point in healthcare where predictive analytics and AI are fundamentally changing how we approach patient care. And we are also seeing AI algorithms becoming increasingly sophisticated, right, at analyzing patient data and predicting health outcomes. So this raises a fascinating question about the evolution of healthcare per se. There's often discussions about AI replacing certain medical tasks, but in your view, how is predictive analytics actually changing the role for clinicians? Any new skills that they need to develop?
So I think there's two schools of thought around this. On a fundamental level, I don't think that predictive analytics per se changes the role of clinicians, because predictive analytics are merely predictive, right? They are only there to give you an indication of risk or chance or probability. So in some respects, the role of the clinician is still the same. You still have a suspicion, a possibility, and the role of the clinician is to narrow it down, rule it out, or to determine if that is actually a true blue possibility and take the necessary management steps thereafter. So I think really when it comes to sort of the skills that healthcare providers need to develop, I think the two schools of thought around this. One is to be much more familiar with the analytics. So what does it actually mean? How are the outcomes derived? But on the other hand, you could argue that analytics is purely another tool. And so the output from those tools should jive or interlock closely with what we already know and what we're already familiar with, so that it is seamless, right? And I think probably a combination of the two is going to be advantageous, where clinicians get a little bit more grounding in a little bit more of the technology, so they understand it a little bit. No need to be an expert, just understand it a little bit, and then have the outputs to interlock closely with what we're already used to, because after all, it is designed to help to guide decisions and to guide thinking. So why not have the outputs immediately understandable and usable as is?
Right. Speaking of embracing or adapting to these new technologies, right, this seems to point towards like a larger transformation in healthcare delivery itself. At least that's how I see it. Please correct me if I'm wrong. So how do you think the use of predictive analytics can help transform the traditional healthcare model, which, we often focus on treating illnesses after they occur, transform it into a more like a proactive model that sort of like emphasizes preventing diseases before they develop?
So I think, look, it's a question of uptake, and it's a question of what is acceptable to patients, right? So I'm fairly fond of saying, and you'll probably see me repeat this, the propensity to spend on your health when you're healthy trends towards zero, and the propensity to spend on your health when you're sick trends towards infinity, right? So my viewpoint is predictive analytics can help to shift the needle to get people perhaps to spend more resources, not necessarily money, but also time and effort on reducing their risk earlier when they're healthy. And so anything that we can do to shift that needle is going to be highly impactful. So if, let's just say, predictive analytics gets a small population who are maybe at, say, higher risk of cardiovascular disease to actually watch their diets a bit more carefully, to take on more exercise, then that is really going to move the needle.
Interesting you say that, because this shift towards preventive care is promising, but I think it ultimately depends on how reliable these predictive tools actually are, right? I mean, maybe we could discuss the accuracy of current predictive models. From your view, what's the potential margin of error that clinicians, physicians, or medical practitioners need to consider?
So how long is a piece of string, right? I think the more accurate they are, the better. But I think when you look at accuracy, it's purely a prediction, right? So when you look at that, sometimes I think determining accuracy can be challenging. So again, in an example, somebody's at high risk of cardiovascular disease, you predict that they're at high risk of cardiovascular disease, but in doing so, you kind of influence behavior, right? So they then start to exercise, they lose weight, and then they don't get a cardiovascular event. So is that prediction inaccurate? Not so, because you've influenced behavior that has changed the outcome. Is it advantageous? Oh, for sure. Like that's exactly what we want to see. So I think sometimes it can be difficult to measure the accuracy. And by and large, these accuracy measures would be based retrospectively, right, on big lots of data, and that means to a certain extent you are only really as accurate, and this is true for I think all AI models, is you're only really as accurate as the data that it's trained on. And so I would argue in some respects it's probably more important to have the most accurate starting data and then you have a reasonable confidence that the outputs can be accurate. If you start with rubbish, you're going to end up with rubbish.
Right. Maybe we can look beyond the numbers, right? So I'm curious about the real world impact that you've witnessed so far. I mean, like from your experience as a physician, what are the most like surprising insights that you have actually seen or discovered from predictive analytics that wouldn't have been obvious through the traditional medical assessment processes?
Ooh, I've not seen a huge amount that has moved the needle necessarily, but let me talk about two quick things here. I think the first thing is that when you talk about predictive analytics, it's gonna get better over time, and it's gonna get more accurate and better the more data that we feed it. So now when we have basically genomic testing that's come down massively in price, that is now actually within the realms of affordability, we are now seeing much more accurate predictions that can be achieved with these models, not just the predictions, but with genomic analysis, you can actually get diagnoses as well. Like you have this polymorphism, which is a sort of genetic variant that predisposes you to having these particular conditions. And so does that count as predictive analytics? Maybe, maybe not, because it's a hard number. It's like you have this, so therefore you're predisposed to this. But when you put it all together, I think not just when it comes to DNA testing or genomic testing, but also with blood testing, with different parameters, with imaging as well, you tend to build up much more of a picture of a person's health and a person's body. And it's not just now, but that data stays. And when there are additional models, you can most likely run those models on the existing data and extract further insights. So I think it's going to be an exciting time where we'll see additional insights come online soon. Now, on the other hand, in some respects, some of the research has shown quite the opposite. So some of the predictive analytics maybe doesn't quite work in all scenarios. So the classic one is sepsis. Now, sepsis is not a prevention kind of thing. Sepsis is essentially when you turn up and you're most likely going to be very, very ill in the hospital. And there are a number of studies, there are quite a lot of studies around this, but there's a lot of scoring systems for sepsis. Some are AI, some are non-AI. And some of the studies have actually shown that the simplest of scoring systems are not far off from a very, very complex AI system, right? They're almost comparable, just about comparable. And so then the question arises, what's the delta between an AI model and a simple model? And in fact, another group of researchers took it even further and said, hey, why don't we compare physician gestalt, which is basically physician comes in, eyeballs you for 30 seconds early on, and then they say, yeah, I think this one's going to be septic. And that was actually proven to be the most accurate in terms of prediction compared to a bunch of the scoring systems. I don't believe that there was a head-to-head with an AI scoring system, but I might be wrong. I'm trying to recall. But regardless, that doesn't show that these very complex scores have no value. Because when you dive into data a little bit, and these parts I do remember, is that in the early stages, that sort of physician eyeball is most accurate. But as you go later on, the models tend to catch up. So the inference from that is that when there's little data that is available to these models, then the human have additional data that is not fed to these models, like smell, right? Experience, intuition, perhaps. But when the data catches up, then these models can start to come into their own. So it's not a case of this or that. It should be a case of physician plus these models. So in the early stage, you can use the physicians to give a prediction, and that would be the most accurate kind of system, so to speak. And then later on, when you get more, you can refine it and feed it to a system, right? Where there are 38 parameters, for example, that I think most physicians would not be able to go through all 38. It's way too labor intensive. So I think that the most surprising insights has always been, it's almost never a if or, right? It's never this or that. It's almost going to be this and that, and when is the best time to use them?
Interesting, but I like to flip it a little bit. It's interesting, right? I mean, AI, predictive analytics, and all the latest breakthroughs and advancements, how it's impacting the healthcare industry. But then again, we come to that point where we need to convey this information to patients, right? And I believe that brings its own unique challenges. I mean, how do you communicate AI predicted health risks to patients, without actually causing any anxiety? Or maybe you can also tell us your experience in helping patients, sort of like understand and act on this kind of information, if you have ever had to deal with any of this.
Right. So actually, I actually think one of the interesting questions is not just what new skills do healthcare providers need to develop. I think another question should be, what new skills should patients also need to develop, right? Facetiously, of course, right? But I think when we try to help patients understand in a frank and transparent manner, that's when you control the anxiety, right? And I think just in general, as humans, we have a very poor appreciation, for the most part, of risk, right? Like it's hard to kind of visualize risk. It's hard to communicate risk, even in the simplest of terms. And so I think that in this circumstance, everybody plays a part. For a number of reasons. We have a lot of resource constraints for clinicians in healthcare institutions. And the scope creep of now having to explain that actually this is an AI model, this is a prediction, these are the error bars, these are margins of error, this is that, is one could argue it is ideal that the clinicians do that, but is it the best use of the clinician's time? So can that time be better used seeing another patient, for example? And I don't think that there's a right or wrong answer around that. We know what the optimal is. It's just, is there any way that we can reach very close to optimal with perhaps information leaflets, patient education? And if it's patient education, then that is potentially scalable, right? Because you don't need to reveal any information. You can use some examples, you can talk patients through. And I think that's a worthwhile investment, in my opinion, because when the patients are engaged, they understand the risks, they understand sort of what the pros and the cons are, not just the risks, right? How some of these numbers are arrived at, then they can make a judgment, not just for this consultation, but for every other consultation that follows. And so what I would say is, in summary, patient education, being transparent, but also I think we need to think very carefully around who does some of the basic education. Of course, if I use a model and it comes out as X% and I explain it to somebody, I need to explain around the X% and all the specifics of it, but not necessarily the fundamentals. And I think the fundamentals are where institutions and organizations can really help to have the great impact on patients.
I'd like to just explore a little bit on the patient education part that you just mentioned. So, when we talk about patient education, are we looking at uh, qualifying it based on which age category they fall in? For example, the younger patients maybe require certain types of education. Those maybe 60 and above, for example, may require something a little bit more detailed because they may not necessarily be exposed to certain aspects of technology like those from the younger bracket. Do we need to do that, or is it? Do you think that's really not necessary as long as it's clear enough for everyone to understand?
You probably need to tier it, right? So you'd probably be saying, hey, this is the basics. These are what AI does. This is how it roughly reaches its conclusions. These are some of the systems. Um, and then have the option for people to say, hey, I need to know more, or I want to know more. This is not enough for me. I am not willing to cut down my alcohol intake or my fat intake, my bacon intake, or my whatever intake uh, on the basis of this fairly basic kind of information and education. I want to know a bit more, right? Like I want to understand a little bit around, let's say, for example, what types of data do they use, right? How do I then access some basic information around the accuracy? So my doctor says it tends to be 90% accurate. What does that actually mean? Like, what does that actually mean? I think the classic example is most people, myself included, I don't actually know what a lot of the weather forecasting numbers mean because they say 90% showers, right? Like, does it mean showers over 90% of the area, or is it a 90% chance of showers, right? It seems to be like a lack of just sort of general knowledge around that, right? And so when we talk about, I think this piece around how much info to give, I always kind of think back to the weather. Like we may not know exactly what 90% is, but that's high. Like it's probably going to rain. And for most people, I think it's good enough to know that whether it's a 90% chance or 90% cover, area rain over 90% of Singapore, it doesn't really matter too much. We know it's a high chance compared to like 10%, right? But there will be some people who will say, actually, what does that 90% actually mean? Like, I really want to know exactly what it means so that I can then kind of have to think about it and make a decision. Should I bring this heavy umbrella out or not?
Yeah, agree. All right. So the last 20 minutes or so has given us a lot to think about. Dr. Terence Tan, really appreciate you sharing your insights into how predictive analytics is reshaping healthcare. And I think with all these advancements, I personally feel it's crucial to frequently have open and honest conversations about the values that 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 should guide the development and use of these powerful tools, right? So at least everyone is aware, everyone can understand, and everyone can appreciate what it stands for and how it's going to help make things easier for a lot of us moving forward. So thank you very much for joining us at Real Tech Real Talk. I hope to see you again, and hopefully we could discuss more in detail on other aspects of technology, basically transforming the industry.
Great. It's a pleasure to be on. Thank you so much for the invitation.
Right. Thank you for watching. Please like and subscribe to Say Exposure.tech on YouTube and follow us on LinkedIn and Instagram. As always, the links are in the description. I'll see you again in our next episode with more tech and more talk.